Sherry Bosher reporting at the annual meeting of the American Academy of Pain Medicine in Palm Springs. One study found that patients with chronic pain who are at high risk of substance abuse can successfully be treated alongside low-risk patients if they engage in a program including cognitive behavioral therapy and other therapies to address their risk of abuse.
We're increasingly noticing that chronic pain patients often have comorbid chemical dependency issues, and more we're seeing these two kind of departments merge clinically and research-wise. So we're looking at, is it possible to treat patients that have chemical dependence issues within a chronic pain rehabilitation program successfully. A group of nurses and staff psychologists, psychiatrists developed a kind of psychoeducation substance abuse program to be used in addition to the regular cognitive behavioral programming within our intensive interdisciplinary rehabilitation program at Mayo Clinic. And so patients that had a history of substance abuse or a family of substance abuse were given the option to participate in this program that met 2 hours a day for the duration of the 3-week program. So at the beginning, we found that a lot of these patients, they used higher levels of drugs, they had higher depression, higher pain interference, and in the end, with giving them the tools to kind of manage high-risk situations when it came to opioids, learning more about the relationship between addiction and chronic pain, we saw great success by the end of the program for both patients with and without substance abuse problems.
This study suggests that individuals with comorbid addiction who use opioids can be successfully tapered without affecting pain outcomes. This particular part of our pain rehabilitation program has been in place for about 18 months. You have to understand and appreciate that this is a 3-week outpatient program where patients attend 8 hours daily, again for 3 consecutive weeks. So unless you have access to that type of intensive intervention, it's unclear whether or not you would have similar results in a typical ambulatory setting.
So I think the biggest clinical implication for this is that patients and people with chemical dependence can be treated for their chronic pain simultaneously within a cognitive behavioral intensive interdisciplinary chronic pain program. It just requires what we found is giving them those extra tools to manage high-risk situations and to understand kind of the family and personal aspects of drug use within the program. We're working on doing a longitudinal study with this and more concretely defining the tools within our program.